Hello, I'm Commissioner Doug Singleterry. I am here at the RVCC vaccination site with Dr. Reddy, who is the Director of the County Department of Public Health. And she's going to tell us different services the Department of Health provides and how the department has been dealing with the pandemic. Dr. Reddy, why don't we begin by you telling us about your background and how you ended up as Director in Somerset County.
I have been at the Somerset County Department of Health for about 2 years now, prior to which I worked as an epidemiologist at the State Health Department for about 5 years, but I have been in public health for over 15 years in the state of New Jersey in various capacities. So when I came into Somerset County, the thought was to be able to combine all of those experiences and move the division forward to where we thought would be the goals. It has been a challenging couple of years, but I must say I'm very proud of how far we've come in Somerset County and what a great job we're doing.
And why don't you give us an overview of the different services the Department of Health provides?
So the department has about 30 employees. We work at 5 different divisions within the Somerset County Department of Health. First one is the CHA program, or the County Environmental Health Act program. This group looks at air quality, water quality, the solid waste, and then water testing. The other program that we have is what many people refer to as the health inspectors. So this group goes out to make sure that the restaurants are inspected, make sure that the food is appropriate, the grocery stores are storing their food at appropriate temperatures. The third program is our communicable disease program. Anytime that we get a direct report of these diseases, our staff, nurses, and our communicable disease staff make sure we follow up with that individual to prevent spread within the community. Our fourth program is the health education program. This program makes sure that we communicate all relevant health information, whether it is going to schools to talk about immunizations and the importance of healthy, nutritious food, or whether it is going to the community to try and talk to food handlers about safe food handling practices. And last but not the least is our emergency preparedness team. This team is an all hazards response team that was created post 9/11. This team is the one that prepares the plans, exercises the plans for us to be able to respond to events like this.
And are there also municipalities that contract with the Department of Health to serve essentially as their local public Department of Health?
We provide local health services for the 9 municipalities that we contract with. So our consumer health program, or the health inspectors, only respond to those 9 municipalities that we contract with. So those are the local health services we provide.
So why don't you discuss the department's role in dealing with the pandemic, with the vaccinations, and what sort of challenges you've had to deal with?
It was January, end of December, January of 2019, 2020, where we started putting together health education materials to send to the public so the public would be aware of what this disease is. There were a lot of questions, and I think the important thing was getting that message across. The challenge to that was messages changed so frequently with the information that was coming in. Once we started seeing cases here in New Jersey, our next step towards the response became identifying the new cases and ensuring that we provide appropriate quarantine and isolation guidance so it doesn't spread. And then we had testing that we were planning to do simultaneously. And we set up this RVCC site to make sure people have the ability to come in and get tested. As we moved forward with that pandemic, the next phase was the vaccination phase, but we continued with testing because that is so important for us to ensure that people have the ability to get themselves tested so they could isolate and quarantine themselves.
We're still dealing with a limited supply of vaccines. Once the supply increases, how many people can you potentially vaccinate per day here at RVCC?
So at RVCC, per day, we're able to vaccinate 1,000 first doses. So if they're coming back for the second doses, that would be 2,000 per day. And across the county, in addition to our satellite sites that we plan to open and another drive-through site that we plan to open, we could easily get to 7 to 10,000 doses per week.
And with the J&J vaccine coming out now, what are plans to help seniors and people who are homebound?
The priority with the limited doses that we're getting is to be able to focus on our senior housing, our homebound population. Those are the populations that can't come to our drive-through or our satellite sites. So we are using J&J as a vaccine where we take it to the people through our mobile site.
And the county just recently launched a waiting list for seniors and people who are homebound?
Correct. So while we are going around through our mobile site, vaccinating our senior centers, and we've had calls from seniors come into our call center, depending on the doses that are available, and then start vaccinating these seniors who are on that waiting list as we get through this.
And going forward, how has this pandemic impacted the way the public health department is going to be run in the future?
One thing that I have realized with this pandemic and in the public health staff is the ability to have people with multiple skill sets. And I think that will allow us to scale up to respond to any of these all hazard responses as they move forward.
Thank you, Dr. Reddy. I know you've been very busy, but we appreciate your time and helping to explain all the good work that you and your staff has been doing.
Thank you, Commissioner. My pleasure.